Good afternoon. My name is Dr. Charlene Fitzgerald, and I am a family physician in Happy Valley Goose Bay, and I'm the president of the Newfoundland and Labrador Medical Association. With me is Dr. Lynnette Powell, a family physician from Grand Falls, Windsor, and our president-elect. This is the third time in 6 weeks that we've come forward to the public with serious concerns about the state of healthcare. Today, we will describe issues of an urgent nature prior to COVID-19, which have been compounded by the inaction of this government and the Minister of Health. We're mindful that next month, the people of Newfoundland and Labrador will have a new premier. With this leadership change comes an opportunity for positive new directions. On the eve of this leadership campaign, the Newfoundland and Labrador Medical Association wishes to set out its key concerns about primary care reform, recruitment and retention of doctors, our ideas for rebuilding the healthcare system, and the seriously delayed contract talks between the Newfoundland and Labrador Medical Association and the government. Over the last 5 years, we've made proposals to solve problems in these areas, but our ideas have been largely ignored by the government. A broken relationship between doctors and the provincial government has a direct impact on the ability of doctors to advocate for their patients and to improve medical care in the province. The primary care segment of the health system contains those services which patients access directly without referral. Many doctors are regarded, family doctors are regarded as being the heart of both primary care and the healthcare system overall, providing important services such as chronic disease management, mental health care, and coordination within the system to ensure patients can access appropriate investigations and specialty consultations. Thousands of Newfoundlanders and Labradorians have no family doctor, and so are left to bounce from clinic to clinic, to emergency rooms, to walk-in clinics, to call-in services. This fragmented system leads to cost overruns, duplication of care, and poor patient outcomes. Family medicine in Newfoundland and Labrador has been eroding for many years, to the point where it is in crisis, lacking a coherent provincial strategy to make important reforms and improvements. In mid-2018, the NLMA partnered with the Newfoundland and Labrador College of Family Physicians and Memorial University's Discipline of Family Medicine to release a 10-year vision for the province for improving family medicine. Together, we outlined and presented to the minister the forces that are creating the current problems in family medicine, the strategies that are working well, and the next steps needed for making improvements. Newfoundland and Labrador has the highest rate of chronic disease and the largest proportion of older patients in the country. As a result, doctors need to spend more time with their patients during a typical appointment to address multiple complex health problems. New medical graduates tell us that the current fee-for-service payment model is outdated and inconsistent with the way new doctors have been trained to work. And the current payment model does not easily support integrating registered nurses or nurse practitioners into family practices to increase access for patients. Doctors want to work alongside other healthcare professionals and work in collaborative teams. So we called for the creation of a new payment model that recognizes the needs of patients and supports the provision of comprehensive family medicine. This will help retain family doctors in the province. Our recommendations have been stalled by the delays of the negotiation of our agreement. Rather than create primary health care teams that serve comprehensive and lifelong health needs of patients, this Minister of Health has built team projects that are focused on single issues disconnected from family medicine and has falsely claimed that these are primary health care teams. They are not. These team projects lack integration with family medicine practices, which is the hallmark of an integrated family health, primary health system. You've heard the minister state many times that the transition of primary care to team-based system is well underway. We cannot stand by any longer without making clear that this is false. Family physicians are still waiting for a program that enables them to bring their hundreds of thousands of patients into primary healthcare teams. This just does not exist. The foundational piece has not been designed and it has not been agreed upon. As the problem of physician recruitment worsened, rather than continue to wait for action from government, we decided to commission a family physician human resource forecast for the province. We hired Dr. David Peachy, a health human resources consultant, to develop a supply and demand forecast for the province. His forecast confirmed an extraordinary deficit of family physicians needed to address the medical needs of the people of the province. It revealed an immediate need for 60 additional full-time family doctors in 2020 and an average of 20 more per year for the next 9 years. One part of the human resource plan called upon the provincial government to do a better job in retaining memorial medical graduates, a resource that too often meets the needs of other provinces instead of our own. The province should recruit between 25 and 30 medical graduates per year in family medicine. Our recent experience is that we only recruit 8 to 15 physicians from our graduating classes. We presented Dr. Peachy's human resource forecast to the Minister of Health. Our recommendations were ignored. Last September, Minister Haggie asked the NLMA to work on solutions to address the needs of patients who do not have a family doctor, while longer-term solutions were being developed. The NLMA promptly provided proposals to the government on the inclusion of nurses and nurse practitioners in physician practices and incentivizing more family medicine residents to stay in the province. Our recommendations have been ignored. Rather than engaging with us to solve the problem of patients without family doctors, the minister recently announced a virtual walk-in service. This service is fragmenting the relationships between doctors and their attached patients and not focusing on the primary or the real need, which is the large group of people who do not have a family doctor or a primary health provider. After we made public our criticism of this service, we also sent the minister our recommendations for refocusing the service to ensure that it doesn't fragment current care and our relationships with our patients. The minister said he would not be entertaining any changes to the program. This situation cemented our view that this minister does not understand primary care renewal or family medicine, nor does he care about the relationship between the doctors of this province. Also last year, the NLMA commissioned Deloitte to help us construct a virtual care strategy for the province. We held a virtual care summit last June, and we invited stakeholders from within the healthcare system and government. Our strategy for rolling out virtual care was presented to government a year ago. It provided practical and visionary guidance to allow patients to access physician care through virtual technology. However, had it not been for the global pandemic, virtual care would still be a major gap in this province. People should be aware that the current improvement in virtual care is based on temporary rules, and these current rules will expire on October the 1st. The relationship between doctors and the Minister of Health deteriorated as well following a unilateral breach to our contract with government. In 2018, the government unilaterally rolled back a significant portion of the compensation to physicians who are faculty members at the Memorial University. This breach of our contract occurred without any consultation with the NLMA. Government has refused all efforts to resolve the issue through negotiation, leaving the NLMA with no choice but to take legal action. and this matter is now before the courts. While this affects a subset of our membership, a breach of our contract is an insult to all physicians in Newfoundland and Labrador, and we feel deeply disrespected by the government's actions. Despite the poor relationship, the NLMA has been active with recommendations to address the structure of healthcare if systemic reform is needed to cope with the financial predicament faced by the provincial government. Doctors realize that the government faces difficult financial times, and it will need a strategy to address this in all sectors, including healthcare. Improvements in family medicine, whereby all citizens receive ongoing care to help them live well in their communities and homes, would be a major start. It is proven to keep people out of hospital and to reduce the overall costs of care. In 2017, the NLMA also recommended an approach to transforming clinical services that would maintain high-quality healthcare while restraining overall growth of costs. The model we proposed was based on an approach taken by states in Australia. We brought in an Australian expert, we held a stakeholder conference, we presented a report to government. If the Australian approach was implemented with a commitment to using evidence when making key decisions, this approach would have had the backing of the NLMA. Instead, the government has decided not to take a comprehensive approach to healthcare system reform, and the system remains largely as it was in 2015. I'll now turn it over to Dr. Lynnette Powell.
Thank you, Dr. Fitzgerald. So, the normal relationship between the NLMA and government is that we negotiate an agreement every 4 years, and that helps us solve the types of problems that Dr. Fitzgerald has just outlined. But our relationship with government is no longer. The most egregious unaddressed issue of all is the 3-year delay in the negotiation of our master agreement. The last time that this agreement was negotiated was for the 2013-2017 period. At that time, we were negotiating issues that were 7 years old. There have been no negotiations since. We have repeatedly and publicly called on the government, both the Minister of Health and the Minister of Finance, to start negotiations. Towards the end of 2019, it had become evident to us that the government was not getting ready to negotiate. We prodded them vigorously, and to our surprise, the two ministers did not even know which minister would be responsible for our negotiations. Many improvements for patients of our province cannot start until we have an agreement with the government. New models of family practice to reduce the number of patients without a family doctor are not even getting discussed. New recruitment and retention strategies languish while patients wait. It is harder and harder for us to recruit new family physicians into comprehensive family medicine practices. We're facing a critical shortage of other specialists as well in disciplines such as internal medicine, neurology, rheumatology, and more. In November, the government of Nova Scotia, our neighbor, negotiated a new agreement with their doctors. Not only is Newfoundland and Labrador now the least competitive province in Atlantic Canada for family medicine, it's actually the least competitive province in our entire country. Not surprisingly, the pandemic has caused another delay in the government's effort to prepare for negotiations. However, as our health system starts to reopen for normal operations, we believe the minister should be making our contract negotiations a priority so we can start addressing some of these long-standing issues. Therefore, last month, we approached the Minister of Health and the Minister of Finance with an interim plan. Just like our colleagues with NAPE and the Nurses Union, with whom the government negotiated extensions to their contracts, we propose an extension to the physician contract until next March. This would allow the government some breathing room, given the unprecedented circumstances around COVID-19 and the unprecedented financial picture of the province currently. We are still waiting for a response. The lack of action from the health minister and his approach to dealing with doctors has hampered our efforts to make systemic improvements within the healthcare system and has created a toxic environment for physician recruitment and retention in our province. In general, our efforts to negotiate a new agreement, which might give some chance to bring sustainability and stability to our system, have been rebuffed by this government. At each and every turn, we're faced with no discussion, a disregard for the excessive time lapses since our last contract, and a general lack of interest in addressing the issues which we believe have a direct impact on patient care. Our focus is on solutions for healthcare in this province, but the government has yet to even come to the table. There are critical issues of patient care at every level. The doctors of the province are speaking loudly to try to be heard on behalf of patients in every corner of this province. Dr. Fury or Mr. Abbott will be taking over as Premier in the coming days. They both bring healthcare experience. We call on them to hear our concerns and, once in office, immediately turn their attention to why so many issues have been ignored by the current government and by this Minister of Health. We extend to the new Premier our commitment to a collaborative and constructive relationship, and we are willing to immediately begin the hard work required to address the issues we've outlined today. Thank you very much for your time. We will now open it up to questions from the media.
I was just hoping a clarification on one or two little things. When you asked for the extension, you said March. Is that March of 2020 or March 21?
So that will be March of 2021.
2021, okay. Dr. Fitzgerald, nice to meet you face to face for the first time. When you talked about earlier about being ignored and how your association has gone to government several times with recommendations on various issues in the healthcare system. When you say ignored, what do you mean? Do you mean no response at all to correspondence or anything?
Oh, sure. Correspondence, but action is really what we're looking for. We've outlined here, recommendations that we've been making to the government dating back to 2016 around healthcare reform, around looking at facilities, around changing the way we recruit and retain physicians. All of these recommendations have been ignored. Plenty of talk, very little action.
There have been no negotiations in the last 3 years?
No, our settlement, the agreement under which we currently work expired in 2017.
And no one has sat down at the table?
We are not at the negotiating table yet. The first movement towards that was at the end of last year when eventually a private company was a consulting company. The government reached out to a consulting company to get some help so that they could start to prepare to get to the table, and we're still not there.
So the health minister did mention that, the NLMA has a lot of face time with government. We do meet with government. Unfortunately, meeting with government does not equate to action on any of the issues that we've brought to them.
So I'm just wondering now, I've been following this association and health ministers for decades. Does anyone ever recall the relationship being this acrimonious before?
Again, we all speak from the time we came from. I was actually a medical learner during the physician strike here in Newfoundland, which was a dark time for our physicians as well. This feels pretty bad to me. It's been 20 years that I've been in family practice, and this is the worst time that I have felt about the relationships we've had with government, for sure.
Does it all fall with the current minister?
Certainly we had high hopes when this minister, a physician himself who's been a physician leader, was put into place. It's been very disappointing to us to realize that we feel that he has not been open to collaboration. He has not been open to communication that would allow us to meaningfully address some of the issues in primary care. In fact, it actually feels like he probably doesn't really necessarily understand what I, as a family doctor, do day to day. That's how I feel when he speaks.
He was the head of the NLMA, I believe, during one of the biggest confrontations with government. Why do you feel his ethics with doctors has changed so dramatically?
Well, it's hard, of course, for me to understand what goes on in a minister's health's head, but at this point, what we're looking for is a better relationship. We're looking for working together. We're looking for trying to catch up with other provinces so that every day Lynnette and I don't see the learners that we train leaving for other provinces. And we hope the minister is also looking for the same things.
I remember not that long ago that the doctors were trying to services. Are you guys there yet?
That is certainly not something that as a group any of us want to consider as an option. We really want to find a meaningful way to amend the relationship and start working on some of these issues for the patients of the province. Every single person in this province deserves to have a primary care provider. They deserve to have a group of people who are taking care of them. That's going to help our system. It's going to help the cost. We want to get there. We don't want to withdraw service from our patients.
And when do you replace Dr. Fitzgerald?
The 12th of September.
Pardon? What time?
The 6th of September. The 6th of
The
September.
6th of September.
Thank you.
But maybe I won't show up till the 12th.
There was a recent announcement about a clinic in St. John's that you actually supported. And I don't think you mentioned that in your original comments today. I mean, are there any other signs at all that they're going the right route?
Well, what we've seen with virtual care certainly is a real advancement. But as we said, we're looking at a deadline where those arrangements expire on the 1st of October. However, some of that work has been helpful for our patients and would continue to be should it go on.